When we moved into the building, that was an opportunity for us to immediately occupy 24 more critical care beds. So the tower has 96 critical care beds in it, but so that starts us down a pathway of continued growth. So we'll ultimately be able to open up another 72 adult inpatient beds, and then at some point we'll be able to build out another 96 beds in the critical care tower in our top 2 floors, so that we'll ultimately get almost 200 more hospital beds, through this critical care tower. And then we will refurbish the old operating room space, which should give us another 10 operating rooms. So what that really does is it gives us more inpatient capacity. And so that's really what that kind of statement was about, is that the rate limiting step for us was we didn't have enough facilities to always accept patients that we could care for because we didn't have space. So this creates space for us to be able to care for them. Now, why that's so important to New Mexico is that when we think about healthcare infrastructure, or I think about healthcare infrastructure, hospital beds are one way to kind of measure that. And so when we compare ourselves with the number of hospital beds that we have in our state relative to other states, we're about 30% below the national average. That really makes a big difference in terms of access to care.